Hello all my UK friends. Good morning. I'm Bill with Rooke Products and I'm here to give you a quick in-service update on the Rooke BKA stump protector that you now have in stock for your BK amp patients. They're in the OR. So a quick recap of why we have this product. It's number one, to protect the patient against a bump or a fall on the residual limb. Number two, it is also great for contracture control. And three, also it provides natural warmth, which gives a boost in perfusion to the residual limb. So let's go ahead and get started with the kit. Everything that you need to put this on your patient is in a package like this. You have one size. This is going to fit on the patient's left or right side. And like I said, one size, you can adjust it by trimming the flaps, and we'll get to that in a second. But everything you need to put this on the patient is in the bag like this. So what we're going to do is open this up. Now, I recommend that you stock the BK in the OR. This is going to be placed on the patient at the very end of their OR procedure before you ship them off to PACU. So you're still going to be wrapping the residual limb the way you normally would, the same bandages. Maybe you use like an ACE wrap or something like that over the wound site, but you're going to go ahead and continue to wrap it like that. So at the very end, you're going to open the package up, and there are several components in here. There's an accessory kit that we'll get to in a second. That has an extension piece. There's also a pair of scissors inside that you can use to do any trimming or adjusting if necessary. And there's a waist belt too that the patient will use once they go to PT. So we are going to open this up, and you can see there's ample padding. It's a synthetic sheepskin-like material. Now, to fit this properly, we want the patient's patella to end up lined up here in the window, this open patella window area. So to get the patella here, we may have to use spacers. We provide two. You might use one or two or none. It just depends on the length of the residual limb. Most of the time, I see one used, and use the one with the soft fleece material. Goes in there, or none. That's what I see most commonly, but if you need to, we have that second one as well. So that's going to go in there. Everything lines up nicely in theory. We've got the patella here. Now we're going to wrap this. Now, based on the circumference of the patient's residual limb, now we have plenty of material here. This can accommodate a wide range of sizes, but we may have to trim this. So if you're going to do that, take your scissors, and you can notice that there are double stitching lines here. So I would recommend you cut off the first section and cut between the lines to get the right amount of material that you need. So for the demo, I'm just going to fold it over though. Everything Velcros together there at the distal end. And again, keeping in mind we've got the patella here in this window. We're going to make the same type of adjustment up here at the proximal end. If we need to trim, we have these double stitching lines. We can cut between there. Now, if you've got a really large patient, and I have seen this happen before, there's an extension piece in the kit, in this package. You just attach it with Velcro here, and then you've got some more width like that, and that can accommodate a pretty wide circumference if needed. So there's that. So we're going to go ahead and wrap this around the patient's proximal end too. Now I've got everything ready to go, and I'm going to buckle it up like so, and then the same down here distally. I want to make it securely snug but not too tight. So again, with the patella visible right here, we're now going to put the patella pad on. This is where we're going to get that contracture control. The device has a rigid back here, and then everything is contoured the way we want it to keep everything in the right angle. So you've got your patella pad, and you notice that it says gentle. So our natural inclination is to torque down on this and make it tight. Well, we don't want to do that. All you have to do for the patella pad is just lay it on here gently and then wrap it. That's really all the pressure that we need to put there on the patella, and that keeps everything right where we need it so that contracture won't form. And again, just as a reminder, we've got this super fleece material for natural warmth, and this is clinically shown to give you a significant boost in perfusion to that residual limb area. If the patient later on downstream complains about being too warm with this, I would remind them that if they are feeling warm, they are getting a boost in perfusion, and that's going to protect the residual limb. So I would like to see the patient wear this. Now, I mentioned earlier that this is great for protecting against a bump or a fall. So to date, we have 31 reported falls of patients wearing this device on their residual limb with no dehiscence, and they did not convert to an AK as well. So we're very proud of that record. So again, great for fall protection and protection against a bump. contracture control, and then the natural warmth gives you a boost in perfusion. So this is machine washable. I'm going to give you a pro tip here. We have that ooh and goo factor, of course, residual bleeding, breakthrough bleeding at the wound site. So to try to keep this clean, we can certainly spot wipe it and clean it as necessary, but when the patient goes home, it is machine washable. But here's a pro tip that I like to do. I get this is a breathable Chucks pad. You should have these in your OR, but make sure it is breathable. You're going to take your scissors and cut a piece of this and then wrap it around the residual limb before you put it in the device, where you can sort of line it. And then what I like to do to prevent, or not prevent, but just helps manage incontinence better, I have some of the pad come out over the top, sort of like a waterfall effect almost, and that helps to protect this from incontinence and whatnot. So again, it's not a perfect answer, but it's going to help make it a little bit more manageable. So one last thing to show you, there's a patient belt in this kit. Now, you're not going to be using this in the OR, but it's important that that belt goes with the patient when they start their PT. It's great to help keep the protector on the patient's limb. So that belt, it's in the kit. It's going to fasten around the waist, and you can adjust it. And then there's this tail piece here. This can slide around to either the left or the right side, whatever we need. And then there's Velcro that'll be here on the inside. And what this does, if you can see, it just kind of attaches here, and it's going to help hold everything in place when they're moving around for their therapy, or if they get out of bed or whatnot. So again, I would make sure that we stress to the floor that the patient goes to that this needs to be on them. If they are in bed and they're with it and they are getting too hot, they can take it off or open it up for a little bit. But if they're going to be getting out of bed, they really need to wear this. Again, for protection, that's the main thing. So that's all I've got. If you have any questions, Paula knows how to get a hold of me. I certainly hope to get back into your hospital soon as everything opens back up. But in the meantime, I wish you all the best. And thanks so much. Bye-bye.